here, but these last two slides are really, I talked about distress tolerance, and that being a contributing factor to somebody's ability to withstand stress and cope with stress. So the last two slides here are some tools that we can teach patients and folks that we work with about how to decrease their stress. Again, kind of that short-term stress in the moment. This slide here, this is really great. Dr. Hayes talked about the sympathetic and parasympathetic nervous systems. This is a tool that we want to use when folks are their sympathetic nervous system or fight or flight is really activated to kind of mitigate that and kick on the parasympathetic nervous system. So just to really quickly go through here, a couple of tools. The first one there is, it sounds kind of wild, but either holding an ice cube or dunking your face in a bowl of cold ice water. This like kind of is like a shock to the system. It really kind of changes what's happening physiologically and can again lower that sympathetic drive and increase parasympathetic nervous system. The next one is intense exercise. So again, we want to modify some of these things for certain folks and particularly intense exercise. We want to be mindful of folks who are pregnant and doing what is indicated in that context. But kind of like basically we're engaging in a quick burst of really intense activity that then will kind of lead to this gradual decrease after that burst. So that, again, kind of reducing, it seems kind of paradoxical, but reducing that parasympathetic drive or sympathetic drive rather. The last two pair really nicely together. It's paced breathing. So a little bit of what I just talked about before with mindfulness combined with muscle relaxation. And so again, we're really focusing on increasing the parasympathetic nervous system here by taking really, really slow, deep inhales and exhales and pairing that with clenching muscles progressively throughout the body to create a brief moment of tension and then release the tension so that the muscle physically relaxes. So if we can pair that with the breathing, that will again promote sympathetic nervous system. And then the last slide, if we can go to the next one, is grounding, which folks may or may not be familiar with. This can kind of be encompassed within distress tolerance as well. So again, we're using this in moments of crisis or really heightened emotional arousal. So really focusing on kind of like thinking about like growing roots into the ground, like you're really grounding yourself in the present moment when there's a lot going on, maybe in somebody's mind, physically, emotionally. So really connecting to the present, connecting to the body and the surrounding environment. So there's three different types of grounding. We have physical grounding, mental grounding, and self-soothing. Physical grounding, the 5-4-3-2-1 method you may be familiar with. So this is naming 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. So really incorporating the senses. Mindfulness is something we can pull in here as well to really focus on the present. An example of mental grounding would be counting backwards from 100 by sevens, naming berries, different types of berries, strawberries, blackberries, halle berry, like all the different berries that come to mind. Again, to kind of pull momentarily out of that really heightened period of distress. And then self-soothing. So again, we're incorporating the 5 senses here. So savoring someone's favorite food or drink, spending time with a pet, petting a pet, lighting a scented candle, going outside and looking up at the stars, and kind of incorporating the 5 senses to really, again, sort of ground the person in the present instead of whatever's going on that's chaotic or stressful.
Okay, we're going to go ahead and move to the case. I'm going to stop recording as we don't record cases. One moment.